Good afternoon. We are at St. Joseph Mercy Hospital. I am Dr. Yanela Ramirez, gynecologist. I want to talk to you today about a medical condition that pregnant women can develop, threatening their lives and also the fetal well-being. I am talking about preeclampsia eclampsia. Preeclampsia is a hypertensive disorder, formerly called toxemia. It's a very serious condition that affects 5% of pregnant women. It appears usually after the 20 weeks of pregnancy, sometimes during the labor, and also in the first 48 hours after delivery. High blood pressure is the primary symptom of this condition, but there are some other things that can be present in this disease, like protein in urine and also swelling of the legs, feet, hands, and the face. Many theories have been proposed to explain the mechanisms that trigger preeclampsia. Problems with the immune system, certain genes. The truth is that the exact cause of preeclampsia remains unclear. There is strong evidence that the major cause predisposing susceptible women to preeclampsia is an abnormally implanted placenta that is thought to result in a poor uterine and placental perfusion. A major consequence of all this is hypertension and all the complications and symptoms that are related to preeclampsia. There are some patients that have risks to develop preeclampsia. For example, patients who have a history of high blood pressure prior to pregnancy, patients who have history of preeclampsia in previous pregnancy, having a mother or sister who had preeclampsia, history of kidney disease, diabetes, lupus or rheumatoid arthritis, also carrying more than one baby, or nulliparity. We call nulliparity to patients that have the first pregnancy, they don't have deliveries. And maternal age more than 40 years old or less than 17 years old. There are signs and symptoms that patients have that we can use to do the diagnosis of preeclampsia. For example, patients who have blood pressure of 140/90 millimeters of mercury or more, documented in 2 occasions, at least with 6 hours apart. Presence of 300 milligrams of protein in 24 hours urine sample. And also patients with a sudden weight gain or swelling in hands, face, and legs. Preeclampsia sometimes develop without any symptoms. High blood pressure can develop slowly, but most of the time it has a sudden onset. Mild to moderate preeclampsia may be asymptomatic, and many cases are detected by the routine screening. Patients with severe preeclampsia display end organ effects, and they can complain of some symptoms like persistent headache, blurred vision, nausea, vomiting, cramps in the hands, mouth, and sometimes they have chest pain, epigastric pain, or pain in the right upper abdominal quadrant. Dyspnea could be present. It means shortness of breath. And sometimes the patients complain of weakness. Intrauterine growth restriction could be present. It is when the baby grows, but not enough for the gestational age that the patients have. And altered mental status can be present too. In patients that have a new onset hypertension, we need to do some tests, blood tests, urine tests, like a complete blood cells count, dosification of the liver enzymes, and coagulation profile to monitor the liver function. Also serum creatinine to monitor the kidneys function. Uric acid, 24 hours protein collection for proteins, and electrocardiogram to check the maternal cardiac activity, a retinal scan, kidneys and liver function as a complement to monitor the function of these important organs. And of course, we need to monitor the fetal well-being. In this case, we check the fetal movement counting. We can do a biophysical profile, and we can do an ultrasound Doppler from the umbilicus blood flows. In moms-to-be, preeclampsia can cause rare but very serious complications like stroke, seizures, or convulsions when preeclampsia lead to eclampsia, heart failure, pulmonary edema. It means water in lungs. There is an important and serious complication that we call HELP syndrome. It is characterized by hemolysis, elevated liver enzymes, and lowered platelets, bleeding from the liver, and also bleeding after the patient has given birth. There are some complications for babies too. Preeclampsia can cause the baby to be born very small. Premature birth with all the complications that follow, like learning disabilities, epilepsy, hearing and vision problems, cerebral palsy, and sometimes preeclampsia causes that the placenta to suddenly separate from the uterus, that we call placental abruption, and it can cause stillbirth. There is no way known to prevent preeclampsia, and there is no cure except for delivery of the baby. However, we can improve the outcome by prompt recognition and management of this situation. For example, diet, protein or calories supplementation, or restriction of protein. Even changes in salt intake have no effect on preeclampsia rate. Some authors consider that the treatment with antioxidants is not useful to prevent preeclampsia, but taking into account that in this disease there are some free radicals released, many physicians promote the use of the treatment of antioxidant to prevent preeclampsia. Calcium supplementation, at least of 1 gram daily, is recommended to prevent preeclampsia. Taking aspirin is associated with 1 to 5% reduction in preeclampsia and 1 to 5% reduction in premature birth. So low dose aspirin is recommended to prevent preeclampsia in patients with high risk. Of course, proper prenatal care is important to check the blood pressure and the weight of the patients in order to prevent this type of disorder. Most of women with the diagnosis of preeclampsia should be admitted to the hospital for a better assessment and management. Antihypertensive drugs do lower high blood pressure, but we only use when diastolic blood pressure is 100 millimeters of mercury or more, and sometimes in patients with lower blood pressure but persistent symptoms, as we described before. The most common drugs used in the treatment of preeclampsia are methyl dope, labetalol, nifedipine, and sodium nitroprusside. When diastolic pressure is 110 millimeters of mercury or more, diuretic drugs are used, like hydralazine. Magnesium sulfate is used to stop or to prevent seizures or convulsions in patients. It's used to prevent eclampsia. In cases with severe preeclampsia and gestational age more than 37 weeks, and after the control of the symptoms, the induction of the delivery is recommended. Also in patients with more than 34 weeks, depending on the severity of this condition. In patients with less than 34 weeks, the treatment is an expectant management with corticosteroids to accelerate the lungs maturity in preparation for early pregnancy. The vaginal delivery is preferred in these cases. but it depends of the cervical conditions and also in the fetal well-being. We have a message for pregnant women. We know that pregnancy is a very confusing time. Your body is going through a lot of changes, and sometimes you don't know what is normal or what is a red flag. Learning more about preeclampsia, eclampsia, the complications, the signs and symptoms will help you to identify problems early and ensure the better possible outcome. Remember, you are responsible for your baby and your health. We are here to help. This is all for today. I hope to see you soon.